Alright, well, good morning, everybody. Welcome back to my channel, and thank you for joining me for breakfast. The only reason that I am doing the video right now while I'm eating breakfast is because I just realized that I haven't made any updates, and while I was eating breakfast, it just popped in my head like, man, I should do a video now before I go on with my day, and then I'll forget again. So, today I wanted to follow up on my phone calls. I've received a phone call already from my endocrinology department and my transgender department. The last video that I've made was based on the conversation that I had with Karen, which is a lady that called me from the transgender department about doing my top surgery. She had sent me to go do some labs, excuse me, to which I had already sent. To which I've completed, and then I've called her, left her a voicemail, let her know that it's been completed, and I was pending her phone call. Well, she called me actually, I think last Friday, so it took her about 2 weeks for her to get back to me, to let me know she received my labs, everything was fine, and now she made an appointment for me for September the 4th, not September, that's too far along from here, May 14th of next month. I have an appointment with my transgender department, and I think that's what we're going to discuss, because I'm going to meet with the doctor now. I'm going to discuss, I guess, about what type of surgery I need, and then the pros and the cons, I believe. But yes, so that's that. Now, I also received a phone call from the, I forgot, for my testosterone. Those been a little quicker. They've called me a lot faster than, my top surgery process. So taking my T has been a lot quicker for me. I haven't been on T yet, so remember, these videos are pre-T. But they called me last week, schedule an appointment for me to go home and meet up with one of the doctors. I think it's called endocrinology department. There you go. So I went. My fiance and I both went together. We spoke with the doctor. She also asked me a quick question. I guess she wanted to make sure that this is something that I really want to do, because it's a life-changing decision. It's not something to play with. So she was, trying to refresh my memory with this. Asked me questions about how long have I been dressing or living in the life of a boy, and for how long have I had that decision of transitioning. And then she told me the pros and the cons, and she told me that the fact that I'm going to be on T, it will increase my, I'll be in a higher risk of getting ovarian cancer, or issues like that, because the high level of testosterone that my body's going to have. She did mention that she doesn't want to encourage me that I'll be able to have children in the future because I will become infertile. But that there has been cases of people that have been able to have children. However, I myself do not see myself carrying a baby. Not that it's wrong. I mean, I know I am in a physical body, just I don't picture myself carrying a baby. I want my fiance by then to be my wife, and I would like for her to carry our baby. But she told me not to have my hopes up, because there might be a chance that I might not be able to I'm sorry, my ovaries might not be able to function properly. So that's a risk that I'm taking. So she talked to me about that, and then she also sent me to go do some labs, which I did. And after I did my labs, that was, I think, last Friday. Yesterday already. So I mean, I'm telling you, the the endocrinology department's a lot quicker. You know, they're boom. You know, they're on it. It's a lot faster than my process with my top surgery. And I think that's because of, you know, when you're doing top surgery, people are on a waiting list, and the doctor from the endocrinology department was actually surprised that I'm doing both of them at the same time, because she was telling me that usually transgender therapists, they recommend transgender, not transgender therapists, I'm sorry, gender therapists usually recommend transgender men to be on testosterone for about 2 years before being able to move forward with top surgery. In my case, I got approved right away for both of them. So I think it all depends on circumstances of people. I've been living like this since I could remember, pretty much since I was, I think, well, not since I could remember, but well, yeah, I mean, at home. You know, on closed doors, I've always been a little boy, but outdoors, when I came out and I started dressing like this, times, and I stopped dressing like a girl, then that was when I was, I think, like, I don't know, 16, 18, I don't really remember, but I'm 30 years old now. I'm about to be 31 in August, so it's been quite some time for me. But yes, I did my labs on Friday. I did my appointment with the endocrinology department on Friday. They called me right back today, told me my labs were good, so that's perfect. And they told me I got approved already for, they prescribed me my shots. I think it was 200, for my testosterone, I think it was 200 ml, something like that. I don't remember. So I need to go to the pharmacy first to get everything that I need. My needle, I'm scared of needles. My needles, everything I need. And then they made me an appointment for today at 10:30 in the morning, where I will be meeting up with the doctor again, or someone from the office, I believe. And they will show me how to put on my first shot. So today I will have my first shot. I guess you could say this would be my last video pre-T. So for those that are not on testosterone and have not started testosterone yet, so you know pre-T means before testosterone. So this is my voice right now, pre-T. After that, I'll do a couple more videos, whether every time I notice a change, I think I'll just do a video, maybe every week. I'm not sure. I'll play it by ear, but yeah. So that's my update. So anyone that has any questions about how to get started with testosterone and with top surgery, like I said before, please speak with your primary doctor first. Your primary doctor will recommend you to speak with a gender therapist. Please go with the gender therapist. Please be as honest as you can with the gender therapist. Their goal is to identify whether you are a transgender person or not, or if it's a phase or maybe just a trauma that you've been through, that now you out of nowhere think that you should just, you hate being a female, now you want to transition, or vice versa. So they want to know, they'll ask you details about your personal life, your sex life, how you feel inside, how your childhood was. They'll ask you a bunch of details, and then the gender therapist will let you know if you're considered a transgender individual. Once that decision's been made, the gender therapist will send the referral either to the endocrinology department, which is for your testosterone, or to the top surgery transgender department, which is will do the top surgery, or to both at the same time. With me, she did both of the referrals at the same time, sent both of them out. It was a long test that we did. She asked a bunch of questions. Like I said, it took me like three sessions with her. They each are an hour, about an hour session. But yes, coffee is delicious. But yes, after your referral's been sent, the endocrinology department will call you, set up an appointment with you. They'll talk to you, give you the pros and the cons, right? Then they'll send you to go do some labs. Once those labs come back, Then they will tell you whether you or they'll tell you what you qualified for, like how much of a dosage of testosterone I guess you should be getting. They schedule another appointment for you. Well, they'll show you how to do the shots, or if it's just a gel that you decided to do, because there is a gel and there are the shots. Then either, I think if it's just a gel, then I guess you just go to the pharmacy and you'll get your gel, and they'll show you how to apply it and stuff. Or with me, I got the shots, so I'm gonna go to the pharmacy, pick up my stuff that I need, all of my kit, and then I'll have my appointment today at 10:30. Will they show me how to use everything, and then after that, they will tell you, because this is what they told me, that every 3 months we will have to do some labs, because they want to see how you're doing, how your body's taking it, making sure that you're not at high risk of anything, that you're not sick, just making sure that you're healthy. So every 3 months I need to do that, and then I was told that my shot, my tea, I need to do it for every 2 weeks, and then after that, then they'll tell me I guess when I need to do it lower, or I'm not sure. But as of right now, that's how it is. With the transgender department for top surgery, they will call you. They might not schedule an appointment to go in. They might just, on the phone send you to go get some labs. You will get some labs. Stay in communication with them. Let them know once you've completed your labs. Once they've received your results, they will call you back, and then they will schedule an appointment for you. To where you will go, they will discuss about what process is next, and then I don't know from there. This is where I'm at. I think I'm pretty much done on the process of getting for the endocrinology department, and I'm still kind of halfway there for the top surgery. But yeah, that's where I'm at right now. Thank you guys for joining me for breakfast this morning. I hope you guys are having some delicious breakfast yourself. I'm having oatmeal and banana pancakes with some almond milk, my coffee with some almond creamer, some maple syrup, flax seeds, chia seeds, my omega-3s, everything I need to do. Let's get strong, let's get started, let's get ready. And yeah, comment below, please subscribe, please like my video. Any questions, please feel free to ask. I will do my best to make these videos as educational as I can. Okay, bye guys, take care.